If you're pregnant or planning to be, this might surprise you. Many of the tests your doctor orders during pregnancy aren't actually necessary. Let's break down which ones truly matter and which ones are just adding to your medical bills. Asterisk in modern prenatal care. One of the most common examples of overtesting involves the excessive use of ultrasound imaging in low-risk pregnancies. Ultrasound technology is an incredible medical tool that allows us to visualize the developing baby, monitor growth, detect abnormalities, and reassure both parents and clinicians. However, when used too frequently without clear medical justification, it can lead to unnecessary anxiety, false reassurance, and inflated healthcare costs. In healthy pregnancies, professional guidelines generally recommend one scan during the first trimester to confirm gestational age and another, around 18 to 22 weeks to assess anatomy and growth. Beyond that, additional scans are typically reserved for specific concerns such as growth restriction, bleeding, or abnormal lab findings. Despite these recommendations, many women undergo 3, 4, or even 6 ultrasounds during pregnancy. Sometimes just because the technology is available or because parents want extra reassurance. What's often overlooked is that more imaging does not necessarily lead to better outcomes. Each scan should serve a purpose, whether it's to answer a medical question or confirm a suspected issue. Overuse can create confusion if minor, clinically insignificant findings appear, leading to further tests and anxiety. The responsible use of ultrasound should be rooted in evidence and medical need, not habit or convenience. Asterisk a second area of overtesting involves the growing number of genetic and hormonal screening panels offered to pregnant women. With advances in laboratory technology, it's now possible to screen for a wide range of chromosomal and genetic conditions through blood tests early in pregnancy. These tests can provide valuable information, especially for women at higher risk or with family histories of certain disorders. However, the marketing of these tests has sometimes outpaced the medical guidance that should accompany them. Many expectant parents are offered multiple overlapping tests that check for the same or similar conditions, often without a full understanding of what the results mean. False positives or uncertain results can cause immense emotional distress and sometimes lead to invasive procedures like amniocentesis, which carry their own risks. The key is to ensure that genetic testing is targeted and individualized. When patients receive thorough counseling about what each test measures and what the results could imply, they can make informed choices. Screening should empower parents, not overwhelm them. Over-ordering in this area turns a tool for reassurance into a potential source of anxiety and unnecessary intervention. Asterisk. The third major example of overtesting happens with routine urine and blood tests late in pregnancy. Early in prenatal care, these tests play a vital role in detecting issues like anemia, infections, or gestational diabetes. But once those screenings have been completed and results are normal, repeating them at every visit offers little benefit for most low-risk patients. Still, many clinics continue to perform these tests out of habit or protocol rather than evidence-based reasoning. Frequent, unnecessary lab work not only increases costs, but can also lead to misinterpretation of minor fluctuations that are completely normal in pregnancy. Small variations in blood counts or urine findings can prompt further testing or interventions that are not truly warranted. A more thoughtful approach involves tailoring follow-up testing to each patient's risk factors, symptoms, and clinical findings, rather than following a one-size-fits-all schedule. This helps maintain focus on genuine health concerns while reducing the physical and emotional burden of over-medicalization. During pregnancy, genetic and hormonal tests represent one of the most remarkable advancements in modern medicine, particularly in prenatal care. These tests have completely changed how doctors and parents understand and monitor the health of both mother and baby during pregnancy. In the past, most information about fetal health came from ultrasounds and physical examinations, which could only reveal structural or visible abnormalities. But with the development of genetic and hormonal screening, We can now detect a wide range of chromosomal and metabolic conditions much earlier, often within the first trimester. This has allowed countless families to prepare for potential complications, make informed decisions, and ensure better medical support for their babies before birth. Asterisk, however, the growing availability of these tests has also led to their overuse. Many expectant parents are offered multiple overlapping panels that check for similar genetic markers or hormonal imbalances, even when there is no medical indication to suspect a problem. In some cases, these tests are promoted by private laboratories or healthcare facilities as advanced or comprehensive packages, creating pressure on parents to accept them out of fear of missing something. This phenomenon has turned what was once a carefully targeted diagnostic tool into a routine practice, often without the clinical reasoning that should guide it. The truth is, not every pregnant woman needs every available test. The decision should depend on individual risk factors such as age, family history, and previous pregnancy outcomes. Asterisk. Another issue with excessive genetic and hormonal testing is the emotional impact it can have on parents. These tests are not perfect. They can yield false positives or uncertain results that suggest potential problems even when the baby is completely healthy. When this happens, parents are suddenly faced with worry, confusion, and sometimes the need for further invasive testing, such as amniocentesis or chorionic villus sampling. These procedures, while generally safe, carry small but real risks, and often prove unnecessary when the initial screening was not truly warranted. The emotional toll can be significant. Families may spend weeks or even months living with anxiety over results that ultimately turn out to be benign. This kind of stress can overshadow what should be a joyful and hopeful time in a parent's life. Asterisk. There is also a financial side to consider. Genetic and hormonal panels are expensive, and many insurance plans don't cover them fully unless they're medically indicated. Over-ordering these tests increases healthcare costs for families and strains healthcare systems without providing corresponding benefits in outcomes. More testing doesn't automatically mean better care. In fact, it can dilute attention away from genuine health priorities. Asterisk, the responsible approach is thoughtful and personalized testing, one that involves open communication between doctor and patient. Expectant mothers should always be informed about what each test measures, why it's being recommended, and what the possible outcomes mean. Instead of viewing every test as mandatory, patients and healthcare providers should work together to determine what's truly necessary based on evidence and context. When used appropriately, genetic and hormonal tests empower parents with knowledge and reassurance. When overused, they can create confusion, fear, and unnecessary intervention. The goal should always be to use science wisely, to guide, not to overwhelm. Routine urine and blood tests are a cornerstone of prenatal care, especially in the early months of pregnancy. They help detect important conditions such as anemia, infections, and gestational diabetes that could affect both mother and baby if left untreated. These tests play a critical role in establishing a baseline for maternal health, guiding doctors in creating individualized care plans. However, after the essential screenings are completed and results are found to be normal, repeating the same tests again and again throughout pregnancy often adds little to no value, especially for women with low-risk pregnancies. Despite this, many healthcare providers continue ordering these tests as a matter of routine, rather than based on medical need or new symptoms. This practice, while rooted in good intentions, reflects a culture of defensive medicine and over-monitoring that doesn't always serve patients in the best way. Asterisk, in the later stages of pregnancy, it is common to see repeated blood counts, urine analysis, and metabolic panels conducted at nearly every prenatal visit. In many cases, the results remain stable and unremarkable, but the frequent testing persists simply because it's part of the protocol. What often goes unnoticed is that these unnecessary tests can have unintended consequences. For instance, small fluctuations in hemoglobin levels, white blood cell counts, or urine protein may occur naturally as the body adapts to pregnancy. Yet these harmless variations can sometimes trigger unnecessary concern, leading to follow-up tests, referrals, or even treatments that may not be needed. Such over-investigation can cause anxiety for expectant mothers and can turn a routine pregnancy into a medicalized experience filled with unnecessary worry. Asterisk. There is also the question of cost and resource allocation. Every test ordered, no matter how small, adds to the total expense of prenatal care in healthcare systems already under pressure. Excessive testing consumes valuable resources and increases the financial burden on families. Many parents pay for these repeated labs out of pocket, not realizing that the results often offer no new information about their baby's health. From a public health perspective, reducing unnecessary tests allows clinics and hospitals to focus time and funds on cases that truly need closer monitoring, such as higher-risk pregnancies or patients with medical complications. Asterisk. Overtesting can also subtly change the dynamic between patient and physician. When visits are dominated by lab orders and data reviews, it can leave less room for meaningful conversations about nutrition, emotional well-being, or lifestyle adjustment areas that can be just as crucial for a healthy pregnancy. The goal of prenatal care should not be to collect endless data, but to provide comprehensive, compassionate support that addresses the physical and emotional needs of both mother and baby. Asterisk. A smarter, evidence-based approach is to tailor follow-up testing to each woman's unique risk factors and clinical presentation rather than applying a one-size-fits-all schedule. This means evaluating whether new symptoms, medical history, or previous test results justify further testing. For example, repeating urine protein tests is essential if there are signs of preeclampsia, but unnecessary if previous results have been normal and there are no new risk indicators. Similarly, follow-up blood work should focus on specific concerns such as persistent fatigue or signs of infection, rather than being repeated at every visit without reason. Asterisk. Ultimately, responsible testing is about using medical tools efficiently and purposefully. When doctors and patients collaborate to make informed choices about which tests truly matter, prenatal care becomes safer, more efficient, and less stressful. Thoughtful decision-making ensures that medical attention remains focused where it is needed most, protecting the health of both mother and child while avoiding the pitfalls of over-medicalization.